Hello everyone, I'm Mahmoud and I would like to talk to you about endocrine hypertension. Through this presentation in a short video, I'll introduce you to endocrine hypertension. We'll see some of the causes of endocrine hypertension and we'll see why we should investigate for endocrine hypertension. First of all, hypertension is described as elevated blood pressure, that is systolic blood pressure greater than or equal to 140 millimeters of mercury, and diastolic blood pressure greater than or equal to 90 millimeters of mercury. Up to 80% of patients with hypertension have no underlying cause, and this is known as essential hypertension. The remaining 10 to 20% of patients have an underlying cause for the hypertension, and this is known as secondary hypertension. Endocrine hypertension makes between 5 to 10% of all patients with hypertension. Secondary hypertension is most commonly suggested by poor response to conventional antihypertensive therapy in a patient who is on regular treatment. Features that may suggest secondary hypertension including endocrine hypertension, and these features should alert the clinician and the patient. These include onset of hypertension at young age, blood pressure variation with spikes, electrolyte imbalances, particularly hypokalemia, familial kidney diseases, and resistant hypertension, meaning that you require more than 3 antihypertensive agents for controlling blood pressure. Other thing to note, patients with endocrine hypertension usually have very high blood pressures, usually systolic blood pressure greater than or equal to 180 millimeters of mercury, and diastolic blood pressure greater than or equal to 110 millimeters of mercury. Causes of endocrine hypertension include primary hyperaldosteronism, that is elevated serum aldosterone hormone. Patients will present with headache, muscle cramping and weakness, and their hypertension is mostly diastolic. On biochemical analysis, they have hypokalemia and metabolic alkalosis. Cushing syndrome, that is due to elevated serum cortisol. Patient will present with the moon face, central obesity, weight gain and hypertension. Female patient will also present with hirsutism, that is male pattern hair growth, and patient will also present with diabetes mellitus. Pheochromocytoma, a tumor of the adrenal cortex. Patients will present with headache, excessive sweating, and palpitations. These features are most of the time paroxysmal, accompanied with a blood pressure elevation. Overactive thyroid gland will present with elevated heart rate, that is tachycardia, tremors, anxiety, intolerance to heat, and weight loss despite a gain in appetite. Underactive thyroid gland will present with fatigue, bradycardia, and cold intolerance. They also have weight gain despite loss in appetite. Acromegaly, that is due to excessive growth hormone production and function, will present with enlarged jaw, enlarged tongue, and enlargement of the extremities, headache, visual disturbances, and proximal muscle weakness. So why should we investigate for endocrine hypertension? First of all, the global burden of non-communicable diseases, including hypertension, has been increasing. This is most likely due to changes in our lifestyle and environmental factors. Mortality attributed to such diseases is between 70 to 80% of all deaths. They are also among the most frequent causes of morbidity, disability, and impaired quality of life. So anything concerning hypertension should be of great concern. There are groups of patients who are on regular treatment for hypertension with good adherence but poor control. Most of these patients do not get the appropriate investigations to look for the underlying cause due to resource constraints, including human and diagnostic. We have facilities that serve patients with hypertension, but they do not have the expertise including endocrinology and cardiology. And some do not have diagnostic facilities including hormonal assays. Studies have shown that endocrine hypertension is associated with more cardiovascular events and more other types of organ damages, including renal damage, among patients as compared to those with essential hypertension. Studies have also shown that most of these changes can be reversed by treatment of the underlying cause if they are detected and managed early. Fortunately, almost all endocrine causes of hypertension can be cured. For those that are incurable, they can be treated and managed well with proper medication. And treating the underlying cause usually results to resolution of hypertension and associated organ changes. Thank you for your time. For those of you who will be interested to learn more about non-communicable diseases and endocrine hypertension, you can start through these references and go further. For your time.